Hi, this is Dr. Greg Oliver, and hello again from Fat Doctor TV. Excited to talk to you today about medications. Now, a lot of patients who want to lose weight are interested in using prescription medications to assist them in the process. And there are physicians who do use medications, but you'll find that many physicians are wary of medications, and I believe, unfortunately, for a lot of the wrong reasons. I used to think that medications were a crutch or not necessary for patients to lose weight, but then went and learned the facts about medications and became a member of the American Society of Bariatric Physicians, have attended many courses and studied medications, read many articles regarding medications, looked at lots of studies, and have come to the conclusion that in many cases medications do work well. What I tell a lot of my patients is that we have genetic factors that are present in our weight gain and obesity. We also have biochemical factors that we're just now beginning to understand that to increase our risk or increase the ability for us to gain weight easily. I mean, I have patients who do say, I hardly eat anything and gain weight, or I just smell food and gain weight. There's probably some scientific basis behind that. So if we know that our brains have issues that cause us maybe to eat too much or drive us to eat too much of the wrong foods, such as a diet high in carbohydrates, and some people maybe they eat too much fat, then wouldn't it make sense if we had medications that would kind of dial back that urge and that craving in the brain to eat those certain foods? We also know scientifically that certain foods, such as the high sweet or high carbohydrate foods, probably even the high fructose corn syrup, tend to drive a cycle in the brain that make us want to eat more. And almost anyone who has a lot of weight to lose or carries around a lot of excess fat will tell you that when they start to eat certain foods, whether it be candies or cookies or cakes or those kind of high sugary foods, they can't stop. They tend to eat more and more and more. And so many people, and I included in the past, would sit down with a bag of sweets, and before you know it, the bag's empty, when that's probably 15 or 20 servings. So let's look at some medications that we use nowadays to help patients to try to turn off the switch, as I call it in the brain, to assist them to stay on a dietary plan. You know, I tell a lot of patients, what diet works best? Well, the one you can stay on. If you can't stay on a diet, you're not going to be on the program long and you're not going to lose weight. So any kind of dietary regimen that reduces calories, allows you to lose fat tissue, it's ideal if we can keep people on the program, and therefore using certain medications may help. There are different classes of medications. The first class I want to talk about is called sympathomimetics. These are what people call the stimulants. Now, these are not amphetamines. Amphetamines were used for many years for dieters or people to lose weight, but they certainly were quite dangerous and are not used anymore for dieting or weight management. We use sympathomimetics, which are amphetamine-like, which means they behave like some of the amphetamines, but there's been no studies to show that these drugs are addictive or habit-forming or create tolerance. There have been many studies looking at these, and none to date have shown that. We're talking about medications like phentermine, or the brand name Adipex, diethylpropion, or the brand name Tenuate Dospan, and then phendimetrazine. These are the three sympathomimetic, the mild stimulants, that are very good at decreasing the appetite. We call them anorectic medications. And of course, there are certain caveats, things that if you don't want to take these medicines, and you'll need to discuss it with your doctor, have a checkup, go through the protocols that are necessary to get on these medications. But if you're pregnant or nursing, you don't want to be on these medicines. If you have active heart disease or an active systemic medical problem, certainly you shouldn't be on these medications. Also, if you have anorexia nervosa or an active psychiatric problem, you shouldn't be on these medications. And certainly if you have sensitivity to any of the stimulant medications, you should avoid these. Another class of medications we use are the antidepressant, anti-anxiety medications. Now, we know that a lot of patients are stress eaters. When the anxiety goes up, they eat. If they're depressed, they eat. If they're under a great deal of stress for any reason at all, they tend to eat too much. And medications in this class, there's two different classes within the class. One are called SSRIs, or serotonin reuptake inhibitors, selective serotonin reuptake inhibitors. That would include medicines like fluoxetine or Prozac. sertraline, which is Zoloft, and Lexapro and Celexa. It's kind of cousin drug Celexa. And these relax or calm the brain in a certain way, and many patients who are stress eaters will decrease their eating and do quite well. Another of the antidepressant class that works very well are what are called the norepinephrine and dopamine reuptake inhibitors. You don't have to remember all these fancy medical terms, but knowing that bupropion, the old Wellbutrin, works very, very nicely for weight loss, and it works on those chemicals in the brain to try and decrease that. Incidentally, bupropion or Wellbutrin has been used for many years in smoking cessation, so it does work on some of the habit-forming patterns that develop within our brain. Insulin sensitizers are another class of medication, and one that's very common is metformin. Metformin is used in diabetes. It makes our body more sensitive to our own insulin. And we know that in a lot of cases with obesity, insulin levels are high, which drives hunger, and if we can make our body more sensitive to insulin, then hunger should go down. Now, there are some also newer medications out there which are called glucagon-like peptide analogs. Again, you don't have to remember that, but Byetta, which is a twice-a-day injection we use in diabetics, but it also tends to kind of blunt the insulin response, kind of the opposite of response that insulin has in the body. And a new one called Victoza, which is a once-a-day injection. So these have been shown in many patients, especially our diabetics, to cause weight reduction, though the primary purpose is to treat patients for diabetes with these. Another class is called the anti-seizure medications, and they've been around a long time. Topamax, or the generic topiramate, has been shown to reduce hunger and cause weight loss. Also, zonisamide, or the brand name of that, Zogran, has done the same thing. These medicines also give you what is called dysgeusia, which means that sweets taste very funny, almost metallic. And I've had patients we've placed on these medications tell us that sodas taste like metal and they quit drinking them, or sweets taste unusual. And in a lot of cases, that's only one of the effects that causes us to eat less. They also work in the brain to decrease some of those patterns that cause us to eat too much. Another class of medications that are out there are in FDA evaluation right now, which are combinations of some of these. And we won't get into those today. We'll talk about those at later dates. But in many cases, physicians who help patients lose weight through the use of medications so that they can stay on an appropriate dietary plan will use combinations of these medications. One such combination we call Fenpro, which is phentermine or Adipex, along with Prozac or Lexapro. So we kind of calm the nervous system while we're also decreasing the appetite. Using zonisamide or topiramate with phentermine works very nicely also. And so various combinations of these medications can also be used. Now, it's very important to state that before using these medications, you really must see a physician who is well versed and trained in using these medications for the purpose of losing weight. So you'll want to consult a local bariatrician or someone who's been trained in the bariatric field. One way to find out is to look at the website for the American Society of Bariatric Physicians and see if there's a physician in your area that's trained to do that. Many of the bariatric clinics or bariatric facilities that also do bariatric surgery may have physicians on staff that are trained to use these medications. Also, be aware of side effects, potential side effects. Discuss that with the physicians who's going to prescribe the medication. You should be seen on a regular basis. You should be monitored, such as blood pressure monitoring, weight monitoring, listening to your heart and lungs, just to make sure that you're not having any ill effects from the medications. And if you are on these medications, make sure if you have a problem to contact your physician immediately. So today I wanted to go over just a few of the medications that are available out there that are being used in the prescribing and treatment of obesity and weight management. We'll go into some details in further episodes about specific medications, but today was just an overview of those current medications. There are some new ones that are coming down the pike. Unfortunately, some of the medications, such as Meridia, has been pulled from the market. Excuse me. It did have some good effect, but overall it was felt not to be as effective and was pulled from the market. So unfortunately, we don't have a large armamentarium of medications, but these are some of them that will help you. So feel free to discuss it with your physician, but make sure your physician is well read and up to date on the medicine. Excuse me. Well, that's it today from Fat Doctor TV. This is Dr. Greg Oliver. I'll see less of you next time.